Good morning, Malcolm.
Good morning. How are you doing?
Good. How are you?
I'm great.
My name is Sarah Garrigal, and I work with the Living Archives Project, where we are collecting stories of how COVID-19 impacted various minority communities around Charlotte-Mecklenburg County. Today is November 15th, 2022, and this week there are 127 reported cases of COVID-19 in Charlotte-Mecklenburg County, which actually shows an increase of 23% over the last 2 weeks. Therefore, Malcolm is comfortable not wearing a mask today, but I choose to wear a mask. Will you introduce yourself?
Thank you. My name is Malcolm Graham. I'm a member of the Charlotte City Council representing District 2. I formerly served for 10 years as a member of the North Carolina State Senate representing District 40, chairman of the city's Housing Committee, where we distribute a number of millions of dollars for COVID relief, and also served on the COVID-19 task force via the Foundations for the Carolinas.
Thank you so much, Malcolm, for your time today. I really appreciate it. Yeah.
I came to Charlotte in 1981 on a tennis scholarship to attend Johnson C. Smith University from Charleston, South Carolina.
Wow.
So I've been here since 1981.
That's incredible. So you have seen the city transition through time. As you know, you've been here since the 80s, and I bet there's been so much transition since then.
Charlotte is the 15th largest city in the country right now, and when I got here in 81, certainly wasn't there. On the corner of Trade and Tryon Street, when I first got here in 81, was the Eckerd's Drug Store, the Burger King, the pawn shop. Today it sits as the home of Bank of America, one of the largest financial institutions in the country. And so it certainly demonstrates that over those years, the city has grown tremendously, both in terms of its population, but its diversity, its people, its way of life. And now we're the 15th largest city in the country.
That's incredible. And not only are you an incredible politician, you are also a father, correct?
Yes, I'm a father of two. I'm married for 34 years.
Amazing.
My wife, Kim, two daughters, 30 and 27, and a grandfather of two, a 2-year-old and a 4-week-old. So
that is so precious. I bet you just love seeing your grandbabies.
Yes, yeah.
So tell me a little bit, Malcolm, about your experience at JCSU.
Well, I came in 81 as a freshman, got here on the tennis scholarship, and spent 4 years there, probably the best time of my life in terms of meeting friends, creating relationships, getting a good, solid education that propelled me for future success. Met my wife there. She also is a Smithite. Most of my best friends that I see today, fraternity brothers or alumni, are all graduates of Johnson C. Smith. So the university is the foundation that I stand on today.
Yes, and they are an incredible university, that's for sure. Can you tell me, how did you get involved in politics?
Majored in political science, and I've always had an interest in public affairs, community relations, and came to Charlotte and majored in political science. That's where I got my bachelor's of science degree. I loved public affairs, reading newspapers, getting involved in what's happening with the community, and so it was an easy route for me to get involved in the community, volunteering, and then running for public office.
Yeah. Can you tell me a little bit about, because you were a politician way before COVID-19 kind of came, tell me a little bit about what was that experience like for you as a politician and just as a
prior to COVID-19?
Prior, and then how did that transition with COVID-19?
Well, you heard about it on the TV first in late December, early January, and it sounded like it was something far, far away. Our national leaders led the country to believe that. So it was something over there. And then as we got into the new year and the disease started to spread to be a worldwide epidemic, and you started seeing of deaths here in the U.S. and first in the West Coast, and then the mid part of the country, and then the East Coast. You knew that we were in for severe time. I remember hospitals being overfilled with those who were sick, makeshift morgues in New York based on the lives that we were losing to the disease. This kind of mixed message in terms of what was happening here on the ground, things that we were seeing and feeling, and the impact of communities across the country versus the message we were getting from our national leaders, right? And so we believe what we saw, and what we saw was that not only here in the United States, here in Charlotte and in North Carolina and around the world, that we were fighting this COVID-19, and that it was a worthy opponent at the time, and it was killing many, many people throughout the country.
Yeah. And when kind of the COVID-19 came to Charlotte and you guys went on lockdown, what was your experience like for that season?
Well, it was first from a policy perspective. Again, I'm a member of the Charlotte City Council, so not only did we have to worry about my own personal well-being, I had a fiduciary responsibility to look out for the citizens of the city of Charlotte. And so it meant that, one, the City Council stopped meeting in person. We started meeting remotely, and then the impact of the COVID-19, where a lot of our citizens, if not all, were asked to quarantine and shelter in place and begin to fight the disease, which meant people were losing their jobs. The inability to go to work made it an impact on their housing, whether or not they were paying a mortgage or a rental, utility payments. I worked at a nonprofit organization at that time, Beds for Kids, and we provide furnishing and furnitures to families in need. And so there were so many families in our community, we were asking them to shelter in place, but didn't have the type of resources at home to do that. Whether it was a bed or making adjustments to begin to educate kids who were then going to school. Now they were staying at home. How do we make room for the kids who are there now every day and try to create an educational environment for them to continue to thrive and grow? And so everything that we knew as a community was upside down. We were at the point of trying to make a decision about the Republican National Convention that was coming to Charlotte, and whether or not it made sense to bring 50,000 people to our community in the midst of COVID-19. And so, and the uncertainty about the disease when it first started, right? And as it progressed from January and February and March, and the more we began to know about the outbreak and how to protect ourselves, whether it was masks or sanitizing everything or sheltering in place, how we work, how we played, impacted the national economy. And so people were hurting, and I was in a position to help ease the pain through the work of government, at the same time working with those in our public health department to ensure that we were doing everything that we could to protect the community and prevent the disease from spreading.
Yeah. What were some things that you guys did to help that?
Well, basic things, right? One, mass distribution, working with Atrium Health and Novant and other healthcare leaders in the city to ensure that people had the necessary tools at that point to protect themselves, which was masks or products to sanitize their countertops and their hands, and just instructing basic hygiene, wash your hands, and a lot of steps that we took along the way to ensure that we curtail the disease from spreading, and certainly trying to identify those resources that was coming from the federal government, i.e. rental assistance, mortgage assistance, getting more monies to nonprofit organizations so they can distribute to families in need through an initiative with the Foundations of the Carolinas. I mean, so this one community approach, whether it was public, nonprofits, as well as the private sector coming together to create the financial resources to help individuals who were trying to battle this disease.
Yeah. How did you feel that the greater community of Charlotte responded? Was there a lot of fear? Was there distrust? Or were people like happy to receive masks?
I think the city responded as we always do. Charlotte is a can-do city, and when a hurdle gets in our way, and this hurdle being COVID-19, made sure that all of our citizens, as much as we could, got the necessary resources to continue to live, literally. And so immediately there was a local fund established through the Foundations of the Carolinas, and major corporations contribute to that fund to make sure that a wide variety of nonprofit organizations who were providing services to individuals in the community who needed it, especially as related of COVID-19, the spike for services went extremely high, that they had the resources to provide to families in need, whether it was organizations with the Urban League, whether it was Johnson C. Smith, who again were sending kids home, but they still had to pay their bills, and restocking health centers in a different type of way to respond to the needs, and et cetera, et cetera. And so the community responded with its best foot forward, providing the resources necessary to ensure that, again, entities throughout the community had the resources to help people help themselves and provide a helping hand during those trying times.
Yeah, and that's so important. I bet the city was so appreciative of all the work of how it's amazing to see as an outsider. I myself am not from Charlotte, but to see how Charlotte really came together to support their community.
It did all facets of it, whether it was our healthcare system led by Atrium and Novant, government, the city of Charlotte. Mecklenburg County played a huge role because the health department is a county agency, not a city agency, so they certainly played a huge role in terms of responding to the virus and making sure that people had the necessary vaccines. And of course, that was a major part of what we did, was making sure once the vaccine was available to the public, because obviously, as you first know, that when the virus came out, there was no vaccine. And obviously, through the wheels of government, they were able to work with pharmaceutical companies to create the vaccine that fight the disease, and then the next step was the delivery of the vaccines to the citizens. And so certainly Novant and Atrium and the health department, city government, venues like the Charlotte Coliseum and Panther Stadium offered themselves as places in the community where citizens can go to get the vaccine. And so the Charlotte Motor Speedway being another. And so these large public spaces became places where individuals who generally went for basketball or football or a race went to get a vaccine to save their lives. And so the community, again, not only did it rally around making sure the necessary resources was there to help combat the disease and help families help themselves, but making sure that once the vaccine was identified, that all segments of this community, whether they lived in Ballantyne or inner city Charlotte, had equal access to getting the vaccines in a way that protected everyone.
I love that. I love that equity, right?
Yes.
The equity piece. So you were on the COVID-19 task force, correct?
Yes.
Awesome. And what role did you take on that task force?
Well, again, once we through the Foundations of the Carolinas, once the pool of resources was put together from a wide variety of companies, I think about $20 million in all. The steering committee, which I sat on, reviewed applications that nonprofit organizations were applying to get funds.
Okay.
And so part of my job was to review the applications that we got in from many nonprofit organizations who wanted to access the dollars that the corporate community had collected to be redistributed back to nonprofits to help people help themselves. So, we funded organizations and provide grant review, and then made a determination in terms of which organizations would get dollars. Whether it was social serve that helped with a wide variety of COVID-19 related issues, the United Way, Johnson C. Smith received a grant, the Urban Lead. There were many others that were really doing grassroots work, boots on the ground, received these type of dollars to help communities, to help families who were experiencing crisis, whether it was housing crisis, the inability to pay their bills. Because again, keep in mind that the virus required a number of us to shelter in place and stay at home, and it shut down a lot of our businesses in the community. And with the business owners shut down, they can't pay their employees. Employees not getting paid means they can't pay their rent. And so there were a number of programs via these nonprofit organizations that stepped in and provided financial resources to families that need them. And so that was my role on that committee, just reviewing the grants and making grant decisions.
That's a huge responsibility.
Yeah, we took it seriously because, again, we clearly understood then, as we know now, that but for the generosity of government and the private sector, that we all had to work together to make sure that everyone came through this crisis as whole as they can.
Yeah, I love that. As whole as they can. It's so important. So clearly, while a lot of people had to stay at home and shelter in place, you were a busybody. You were busy in all areas.
Yeah, because, again, obviously I was doing my public work. I served as the chairman of the City of Charlotte's Housing Committee at the time, and we were responsible for awarding and helping staff distribute millions of dollars that we received from the federal government to support COVID relief here locally. But I also work full time, as I told you. And my first day at work, I was the new executive director for Beds for Kids, a nonprofit organization who provides furniture and furnishings to families in need. And the first day at work, we sent the whole staff home for almost 2 weeks, which was right in the midst of COVID-19, right at the very start of it. And then we quickly realized, the board and many of the members of the team, that we were essential workers, right? Because we provide furniture and furnishings and beds. And if you're being asked to shelter in place and you're living in a house or an apartment with no furniture, no beds, no way to be comfortable, that we consider ourselves essential workers, just like the police officers had to go to work. Firefighters still had to go to work. EMS technicians had to go to work. 911 operators had to go to work. So there were so many people in the community, notwithstanding that we were trying to shelter in place. For essential employees, we had to keep the city and the economy running. And so there were people that, notwithstanding the environment, had to go to work and provide a service. And we did so at Beds for Kids in terms of making sure that families were at their lowest moment, had an opportunity to have a good night's sleep and be able to shelter with a sense of dignity and shelter with a little bit of grace.
Wow, that's incredible work. Did you feel that the need was much higher?
Of course, the request for services, not only with our nonprofit organization, but other nonprofit organizations went through the roof. Because again, people were experiencing a sudden crisis, right? And so one day you were working at a restaurant, the restaurant is doing extremely well, you're going to work on a consistent basis. A month later, the restaurant is closed, and your income has gone away. No fault of your own, but the fault of COVID-19. And so there are a number of and hundreds of those type of examples throughout the community that people were experiencing no fault of their own.
Man, that is a huge responsibility at that time. How was your family impacted? Well,
family, we all were obviously concerned. Fortunately, no one in my immediate family succumbed to COVID-19 by the grace of God. But certainly in communities and the greater family of our community, we lost a lot of lives, and so that was hard. We also lost a lot of lives at a time where close friends may have passed away, and because of COVID, their funeral services was altered, or in some cases, they didn't have a funeral at all, right? Because of the number of deaths that we were experiencing at the time. And so it made you hug your family and be close to your family and assure that everyone was trying to do the appropriate thing at the time, which was to wear a mask, wash your hands, don't 6 feet apart and distancing, number of people in the elevator, large public gatherings, that we all were trying to do the best we can, which meant even for our family that our family reunion at the time was postponed because you don't want to bring 60, 70, 80 family members from all over the country into one group at the time. And so I think our family reunion was delayed for 2 summers. And we finally were able to get together as a family this year for the first time since about 2000. Wow. And so obviously that's how it impacted families during Thanksgiving and Christmas and those type of things. And it disrupted education. If you were a family that had kids in high school or in college or in elementary school, it disrupted their education, their educational patterns, how we traveled in terms of airplane and trains, etc. And so in every facet of our life during that period of time, it impacted, and there was also a need for preparation for anything that you did. You kind of pre-planned when you went to the grocery store, and I remember at the height of COVID-19, I would go to Lowe's, and I would really go in the morning at 7 o'clock in the morning, simply because there was not a whole lot of people in the store, and so you can kind of shop and do what you have to do. The same thing with the grocery stores. You would kind of plan when you would go early in the morning or late in the afternoon to avoid as much public contact as you can.
Yeah. It's so crazy that we went through that. We tried to avoid the crowds, and because of the safety issue, and it was so important. Was it, with all the things that you had to balance with being executive director at the Vets nonprofit and being a politician and being in your family and probably so many community needs and just having that, kind of on your shoulders, what was that feeling like for you?
Well, it's one of those things you just keep on pushing, right? Yeah. I mean, obviously, you really didn't have time to think about a lot. You just had to get the job done, and you had to soldier on. And again, even as an elected official, I considered myself an essential worker. Yeah. And so obviously I just kept pushing and kept doing the work and hoping that we would, through the vaccination and measures and steps that we were taking as a community, that we would get on the other side of COVID-19 sooner than later.
And so now that we've kind of transitioned where restrictions have been lifted, things are getting much better, the vaccine is available to all, how has that impacted you? Well,
it's both hats, right? As a professional and an elected official, it's just trying to getting back to business, right? Obviously, how we conducted business definitely changed during COVID-19, where there's a lot more remote learning for those and kids and remote working, getting more people coming back to the office, a lot more interaction and engagement. It helped our small business owners begin to open back up. Many of our major corporations were inviting employees to come back to work, which means those local restaurants and Other establishments near corporate centers were now getting people in buying, so it helped boost the economy for sure. And it's just trying to make sure that as much as possible, those who needed the help were getting the help, that the resources was getting to those who needed it in a timely fashion. And then trying to, again, as a community leader, make sure that we continue to move forward, because notwithstanding the 2 years of COVID-19, every day we woke up to a new day. And that meant we had to deal with what was happening that day and again, work towards resolution. And so it's really good to be on this side of it now, where while it's not gone, you met the stats when we first started. So it's still here within our community that we're working and dealing with. But based on the vaccine and other measures that we have taken and have taken for the last 2 years, there's a sense of comfort that we've kind of got our hands around how to deal with it, and there's community respect for one another to ensure that we move forward with it.
That's so true. Before we started our interview process, we did this little activity together called a hand map. Is there anything from your hand map, Malcolm, that you would like to share with us?
Well, again, you asked me, I think the first was describe myself.
Yeah.
And I picked personable, sharp, candid, father and husband.
Okay.
And I think the top you wanted the
outside where who supported you?
Yeah, who supported me? Yeah,
and the last 2-3 years.
Exactly. And the one is the community, how the community responded to it, and how we work as much as we could to support one another through it. How people lost their jobs and in some cases their businesses, but were resilient enough to bounce back. And so the community really inspired me. Family and friends, certainly, how they responded to it, and their family and provided support and comfort to one another. As we kind of walk through this unknown together. And so those were the 3 things there.
Well, thank you for sharing. Is there anything that you felt like you gained from your own personal experience?
Well, I'm not sure we gained anything because of the COVID-19. I think we lost, right? We lost so many of our friends and neighbors and relatives to the disease prior to the vaccination, and I think we lost a sense of belief in our government, and I'm talking about the federal government, based on some of the decisions that were coming out of the presidency at that time, President Trump, and his knowledge or lack thereof of the disease. And the timeliness of really sharing with the nation where we were at and what was going on. I think there was lots of trust. And if we gained anything, I think it's the fact that we found out that there's a sense of we can work together, right? That the technology and works through our pharmaceutical companies, and how our manufacturing companies were able to kind of shift on the dime to create the masks and the disinfectants and all those things, so that the nation at its worst can demonstrate its best by individuals coming together, working together, and trying to clear hurdles together.
That's so very true. Coming together, working together to create a better world for our kids.
Yeah, for sure. And so I think that's, when you look at what came out of it, I think that's the thing for me, that in the worst of times, we can create an environment where people are still trying to thrive, and and to make today and tomorrow better than yesterday.
Amen to that.
Yeah.
So during the whole time of COVID, there was a lot of things that happened, especially in the movement of social justice and with the death of George Floyd and all the protests that happened around our country and here in Charlotte. How did that impact you?
Well, again, a lot happened during COVID-19, right?
So much happened.
And so the death of George Floyd, the city of Charlotte was no different than other major cities throughout the country who saw the tape and witnessed what I believe then was a public execution of this man. And the city of Charlotte reacted through protests. Many of our citizens, peaceful protests at times. Others, they got a little bit rowdy in our community. Understandably so, from my perspective. I don't condone violence, but certainly healthy protest is available in a democracy. And even though we were in the midst of COVID-19, hundreds of, if not thousands of people came out in Charlotte to demonstrate their resolve that would happen with police and citizen interaction. Should be one that is mutually respectful to one another and certainly shouldn't lead to a public execution. And they voiced their concerns around that. And many came in masks and shared that. I was involved in a couple of marches myself. My sister, Cynthia, was a victim at the Emmanuel AME Church shooting in Charleston, South Carolina. So I clearly understand the need for social justice and Black Lives Matter. My sister's life matters,
Yes, she does.
and those 8 who died with her. And so, notwithstanding that we had this COVID-19 in our community still showed up in reference to protesting and fighting for change, and I was proud of that.
Yeah. I was not here at the time, but I did connect with some people from around the city, and I was told that a lot of the police force here in Charlotte, actually did protests with their fellow Charlotteans, and it was quite an experience.
Well, yeah, we had some long, lengthy conversation about policing, not only throughout the country, but here in Charlotte. In the midst of George Floyd, there was an incident where officers and citizens walked hand in hand, but we also have some conflicts where there was tear gassing and to disperse crowds in Charlotte, and there was an incident where the protesters were trapped on both sides with tear gas, and which led to more unrest. And so it wasn't all perfect by any stretch of the imagination. Police community interaction is an art form. Every interaction is different, and certainly there are some things in Charlotte that we've believed that we should tighten up, and we did in the midst of George Floyd, working with the Charlotte Mecklenburg Police Department to put additional safeguards in place to ensure that there's no interaction with local citizens that go awry because of misunderstandings.
Yeah. Do you feel like there was change that happened as a result?
Yeah, I think so. I think just recently the Mayor of Charlotte and the corporate community raised over $250 million for the Mayor's Racial Equity Program. And I think that's a direct result of the community coming together to put their money where their mouth is in terms of social change and trying to ensure equality. $80 million of that went to Johnson C. Smith University. Another 20 went to the Quarters of Opportunities, which supported programs up and down Beatty-Ford Road, where Johnson C. Smith is located. And so I think that's a perfect example of people responding to support education, to support the digital divide, to support jobs within major corporations for senior execs to ensure diversity and inclusion at that level. And so I think that's a direct result of that. In addition to, there were a number of police reforms that we made in the light of George Floyd, many of which came from the police department themselves, to ensure that their interaction between our law enforcement officers and the citizens is one that's based on mutual respect.
Yeah, which is so important. If you could wish for any change to happen here in Charlotte, what would you wish for?
Well, I would wish that, somehow that no matter which zip code you live in Charlotte, that you can get an equal education.
Yeah.
That doesn't matter your zip code, that the education for a child that's living in Ballantyne or Beatty-Ford Road is going to be the same, that we create an environment or a city that's affordable.
Yes.
Right, and that affordable allows people to buy a home or get an apartment at an affordable rate, or be able to support their family and maybe even to be able to take a vacation once in a while. For a community that is crime-free, right, and that every citizen respects one another, and that we work together to ensure that our community is safe and secure, and people feel good about themselves and our community. And lastly, if we can figure out how to get around, right, through our transportation network, and really begin to practice regionalism, which I think is really important, because again, going back to COVID-19, it didn't matter. The virus went beyond city lines and impacted the entire region, the entire state. And so how we work together and solve problems from a regional perspective is going to be extremely important, and how we get around, right, in terms of connecting that person with that job to reliable transportation to get back and forth from home.
Yeah, it's so important,
Mm-hmm.
so important. I know that you do work a little bit with affordable housing initiatives, correct?
I do.
What does that look like? 'Cause Charlotte is quite there. There isn't a lot of affordable housing.
It's Charlotte's, like I said earlier, 121 individuals every day move to the city of Charlotte. Charlotte's the 15th largest city in the country. People are coming to Charlotte looking for job opportunities to create wealth for them and their families. Our city has grown to the point where we can't annex anymore, so a lot of our development now is infill development, and that's impacting communities all over the city. And so the affordability of housing now has increased significantly. And they don't increase if people aren't buying them. They're not paying the freight. And so we have to work to create a community where it's, like I said, where it's affordable and people could afford to stay here and live here. I don't want people living in Kannapolis but coming to work in Charlotte. I want them to be able to work in Charlotte and live in Charlotte and thrive here in Charlotte. And so how do we make that important for everybody?
Do you feel like the city is, as a whole, is working towards doing that?
Yeah. We listen. I'm amazed at all the other cities, Atlanta, Dallas, Houston, all calling the city of Charlotte, asking us what we're doing in reference to our affordable housing issues. We got a lot of great results. Obviously, I wish we could snap our fingers and the crisis is over tomorrow. There's no microwave solutions to it. It's hard, steady, grinding work that we have to do to get to the goal line. But I think the programs that we have in place, whether it's our housing trust funds, the community just voted $50 million for bonds for affordable housing. And I think the city acted very responsibly with reference to the dollars that we were awarded from the federal government to support affordable housing and home ownership here in the city. Again, we're trying to create more home ownership opportunities for those. I'd rather, home ownership is the gateway for, transitional family wealth. And so I think we're doing all the right things that we can do to attack the problem of affordability in Charlotte. Unfortunately, these aren't microwave.
Yeah, it's growing pains.
Yeah,
right?
yes, it's growing pains.
Growing
And so we have the Quarters of Opportunity programs, which helps to revitalize 6 inner city quarters. And I think if we do that, we begin to revitalize the neighborhoods around them. And so I think we're doing all the right things. Obviously, we can do more, and we should do more, but I'm proud of the efforts that we're making along the way.
Yeah, well, thank you so much, Malcolm. To respect and honor your time, which I appreciate so much, I would just like to follow up with maybe one last question.
Sure.
And it's, do you have any additional stories or experiences from the last 2-3 years that you would like to share with us?
I guess it's just two, I guess, and I think I touched on both of them during the interview. One is just working for Beds for Kids. And during that time, right in the heart of COVID-19, and delivering furniture to a family who was living in an apartment, and the apartment was empty. And they were doing the best they could. The kid was home from school because they were remote learning. He wasn't really in school because they didn't have the technology or the broadband to get the internet, to be connected and wired, and to be able to go there and deliver furnishings for that family on an effort of my own, making sure that that family had broadband and internet connection, cable, which is now a public utility. It's not for entertainment anymore, right? Making sure that they were connected and wired so the kid could go to school and remote learn was very, very satisfying for sure. And then the work that I think the city of Charlotte did through the Housing Economic Development Committee, which was to make sure that the dollars that we were getting from our federal partners and our major corporations kind of went to the folks who really needed it. Folks who lost their jobs because of no fault of their own, who couldn't pay their mortgages anymore, or their rent, utilities, that we were able to step in directly and indirectly to impact and make that situation different. And so those two are two primary examples of just working through the pain of COVID-19, continuing to let people know that there were a lot of people who were frontline workers that really had to show up and go to work to ensure that the community continued to function appropriately, and to be able to see that now that we're on the other side of this thing and people are now are a better place because of those efforts is really enlightening.
Wow. Well, thank you so much for your time, Malcolm.
Sorry, before we finish.
Yes.
I'm going to ask you guys to do one technical thing, but I wouldn't usually do this, except it's an opportunity with you here. You're one of the few people I could ask this to.
Okay.
You mentioned that, of course, the foundations, the social service agencies, the city, the county had to work together in COVID. And I'm curious, were the mechanisms in place for that? Did you have to create them? And post-COVID, has that cooperation changed, extended? What does that look like?
Yeah, I think that's a great question. I think on the outset of COVID-19 or any emergency that happens, whether it's a tornado, a hurricane, natural disaster, the city and the county has a emergency management team. And on the outside of COVID-19, when this thing really began to be bad, that team was summoned together. and it consists of county leaders, city leaders, leaders from the region, fire department, police department, medic, other emergency-related members all working in one room together. The health department certainly was a part of that command center. And right from the very beginning, that command center was in place to respond to a wide variety of issues that impacted our community. One was making sure that everyone who went on a public bus or public transportation had masks on, helping to identify where and when the vaccine would be distributed to the community, making sure that at that time there were a number of people, medic going to individuals' homes to pick up folks who were sick and bring them to the hospital, working with the hospitals, because they all were in that same room together. And so that is how the community prepared for any type of emergency that group was called into play. And they certainly, I think for well over a year, met daily and certainly were on keeping acknowledging where we were in terms of the number of cases in the community and identifying hot spots, contact tracing. I mean, they were involved in a wide variety of activities that many members of the general public just wouldn't have known.